Hello? 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 मैडम लाइव है लाइव दिख रहा है ना मेरा जैसा या ठीक है हेलो आर यू हियरिंग मी गाइस हेलो हेलो हाँ सर बोलिए ना मैम कोई क्वेश्चंस वगैरह मेरा आवाज ऑडिबल है ओके शुरू कर दो फिर फाइन 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 ओके वो आपने जो हेलो दिस इज डॉक्टर माने Yeah, I'm Gynaec Oncosurgeon working for Dr. Mane Medical Foundation Research Center, 25-bed Cancer Hospital at Rauri district, Ahmednagar. Yeah, basically, yeah, cancer is a uncontrolled growth of cells, and when there is an uncontrolled growth of cells, it becomes a tumor, and tumor is a cancer. There are two types of cancer. There is two types of tumors. One is benign tumor, one is cancerous tumor, and cancerous tumor is harmful and benign tumor is harmless. Yeah, basically in humans the cervical cancer is the most common cancer in rural India, and breast cancer is most common cancer in urban area. So near about there is great morbidity for cervical cancer in rural and remote population. Near about 1,25,000 women die yearly due to cervical cancer, and near about 70 to 75,000 cases are due to this cancer. Yes, ma'am. Yeah, yeah, started. Yeah, it. Yeah. Okay, so audible, na? Audible and visible both. Okay, and people will ask query on writing or something. Sure, sure, sure. Okay, fine. Yeah, so the breast, as I told, the cervical cancer is the most common in rural India. The main causes for cervical cancer is the inhygiene of private parts, then multiple pregnancies in small age, and less interval in pregnancies in rural area. So this is the cause for the cervical common causes for cervical cancer. Another, indiscriminate use of oral contraceptive pills, indiscriminate use of medicines, multiple sexual partners, and uh, no vaccination or the lack of vaccination for certain diseases, certain viruses, or for cervical cancer. These are the common elements we found it for cervical cancer. Yeah. So and so uh, the one for gynec cancer, the only one vaccine is available. The only one cancer is vaccine preventable, that is cervical cancer. That is preventable, 100% preventable cancer by this vaccine. And two vaccines are available, that is gardasil and cervarix. These are the two vaccines are available, but we prefer as a cervarix vaccine. We prefer as a cervarix vaccine. So better that that vaccine is given in 3 doses. That is the interval of first dose is interval of 2 months, and second dose is after an interval of 6 months. Means there are 2 doses. There is 1, 2, and 6 months. These are the schedule for the cervical cancer. And uh, the second thing, for this the cervarix vaccine is considered as the best. It covers all the viruses, that is causative agent for this cancer. So the every woman should be vaccinated in between 9 to 26 years of age for the cervical cancer, basically. Yeah. And second thing is breast cancer, the most common cancer in rural urban area. The the causes for this breast cancer is indiscriminate use of oral contraceptive hormonal pills. Second thing, the breast the previous predisposing for the breast diseases. Then hereditary factors for the breast cancer, means if mother or sister or daughter is having breast cancer, that family, that woman is very high risk for the breast cancer. She should undergo the screening for the breast cancer or testing for the breast cancer regularly. Then third cancer in women are vaginal cancer. The main cause for the vaginal cancer is inhygiene, as you said, as I said earlier, the viral infection, then the multiple sexual partners, then these are the common causes for vaginal cancer in humans. And uh, as ma'am has asked, the homeopathic in lower potency or higher potency has a role in cervical cancer and breast cancer. So some drugs are given, like uh, Ruta, graveolens, hydristic candensis, Lycopodium clavatum, Thuja occidentalis in 200 C potency. These are helpful for cancer, and it has great promise. It has a great promise, exceptional safety, frequent observation of beneficial clinical effects, and low dose therapy is best for cancer, and it has proven the great efficacy in hepatocellular carcinoma in yeah, laboratory animals. Hello. Okay, okay. So these are uh, the homeopathic remedies for the cancer. That's till research being made the on the homeopathic drugs that is been used for cancer. Second thing, the causes for cancer, the female cancer. The first most common and most prevalent in India is the use of tobacco and tobacco related products, like gutka consumption, like misheri is very common in rural area. then certain mawas, the regular consumption of betel nuts and supari or pan. These are the most common causes for the female cancer we found in rural area. The second is alcohol consumption. It's most common in urban sector, that is consumption of alcohol in excessive quantity. The 20 to 30 ml alcohol intake per day has been uh, that's been recommended by the World Health Organization, but more than 20 to 30 ml per day is a consecutive uh, is a causation, one of the causation for cancer. Second is dietary factors. Dietary factors are fatty foods, the foods having high glycemic index or food having high carbohydrate content. These are the foods. These are the responsible for obesity. And second one is low fiber diet. And the diet in high glycemic, the diet which is having the high glycemic index, like chapati, then roti, rice, maida. These are the having the high glycemic index. This substances should be in the less quantity or the adequate quantity. The third thing is our lifestyle, the sedentary lifestyle, no exercise, only the sitting job, the office work, 9 to 5 office work. These are the this lifestyle is not a good for the healthy life. Or then there's pollution. Second thing is pollution. The pollution, whatever exposure of pollution in excess quantity, and that pollution, if you our exposure is pollution is nearby, it is the research has found that 20 years with continuously exposure, because we have, if you are having continuous exposure to the pollution like in metro and urban cities, then it decreases our life by 5 to 7 years. Means pollution contains various chemicals, cyanides, that is the consecutive organism for cancer. Yeah. And less exposure of sunlight and indiscriminate use of over the counter drugs. These are the main factor found out in rural and urban population. People is to take the drugs directly from the counter, directly from the medical shop. These are the, yeah, these are the really uh, growing menace to the health industry and the patient's health. Yeah. The fourth thing, the next causes of cancer is the early marriages. The rural area is a problem is very common. The marriages are happening, childhood marriages, these are happening below the 18 years of age. And next one is the earlier early sexual life or earlier sexual practices. These are also the, yeah, found to be the consecutive factor for cervical cancer. Then multiple pregnancies within short span of time. This is very a common factor we found out in tribal areas for cervical cancer. And the next one is the multiple sexual partners. The multiple sexual partners will exposes the multiple sexual partners will exposes the human papilloma virus transmission from male to female. And it will cause this human papilloma virus, HPV. It is called HPV. This virus will attack the mouth of the uterus or cervix, it is called. So it will hamper the squamous columnar junction of the cervix or mouth of the cervix. And in over the time, automatically it will develop in the cervical cancer. So the only cervical cancer is the only cancer that is preventable by the vaccine. That's why that vaccine acts against this transmission of viruses. This acts against near about 18 to 16 strength of this human papilloma virus. That is why it is 70 to 80% effective in preventing the cervical cancer. So this cancer is preventable. So uh, we must vaccinate our daughters, our wives, our Yeah, anyone relative should be, and even the American Cancer Society also advise this vaccine has to be given to the males also in same age group, because there is transmission from these viruses are mainly transmitted from male to female, from husband to wife. That is why this vaccine should be given to boys also. But in Indian scenario, it's very difficult to explain those things to the patient. The service cervical cancer is most common in women, so women should be vaccinated. People agrees, but people don't agree for the boys to be vaccinated. So the second thing in prevention of cancer, the hygiene of the both internal genitalia, woman as well as male, daily cleaning of genitalia, daily regular shaving of their genitalia, the regular hygiene of their genitalia will keep us away from the sexual transmitted diseases, venereal diseases, and that will automatically keep away from this cervical cancer. So um, we must keep in mind for cervical cancer, the healthy lifestyle, personal hygiene, and there is a testing, that is pap smear testing is must after marriage yearly. uh, Everyone should undergo, women should undergo the pap smear testing for the cervical cancer. And if three reports are normal, mean 3 years this test is normal, then after 3 years this test can be repeated after 3 years. So every 3 years for the life. If first 3 years yearly, and then after 3 yearly throughout the life. So this pap smear testing was simple test. It charges only 50 to 100 rupees or 200 rupees, but it's a very beneficial test for keeping away from this most common cancer in the woman, that is cervical cancer. So we must immediately we must fix or book or appointment as early as possible to gynecologist for this test. Pap smear testing is must. So second thing, the lifestyle changes like good exercises, then early morning walk, yogasana, then gym. Go to the gym for at least 45 to 1 hour for whatever exercise, running, jogging, whatever the trainer advises. And also the this will keep our physically active, and also the keep away from this cancer. So second, the last and most important part for causation of cancer is obesity. Obesity, we should avoid obesity by any means. This obesity is susceptible. Obesity, obese persons are vulnerable for all types of cancer, not only the breast, cervical, and vaginal cancer, but all types of cancer it attracts. So the body mass index, we must take from our family doctor. Body mass index, it should be below 25, and the weight proportion of weight to height should be normal, should not cross about 25. Yeah. So these are the common preventable measures we should take for the cancer. And the pure vegetarian diet is a must, is best for cancer. And among the non-vegetarian diet, the fish is considered as a good for the this to, for preventing this cervical and breast cancer. The fish contains alpha amino acid, and it is beneficial for that. Now I would like to tell you what are the early signs and symptoms of cancer. The most of the cancers are diagnosed in late stages. 70% cancers are diagnosed in late stages. So early cancers are symptoms are for um, cervical cancer, uterine cancer, bleeding, menorrhagia, bleeding, excessive bleeding in menses, excessive pain in menses, excessive pain. Then there is a white discharge, excessive white discharge. Then pain in abdomen before menses, after menses. Then pain or bleeding after intercourse or during intercourse. These are the common symptoms for cervical cancer. If anyone having these symptoms, we must go to the doctor, immediately test us for pap smear, the first test, and ultrasound. This is the first test. We should first consult the gynecologist. Second thing, for breast cancer, there is a lump in the breast or some skin hardening, some lump in the axilla, or some mowing mouse in the breast, or some mowing tumor in the breast, mowing swelling in the breast. These are the common complaints in breast cancer. So we should catch this symptom, and we should consult a doctor for this symptom. And for breast cancer, yeah, for breast cancer, for every day before bath, we should have look to our we should stand in front of mirror, and we should look the symmetry of the both, symmetry of the breast, symmetry of the both breast, any discharge, there is any comparison in size of the breast, anything. So, and we should palpate by our hand to the hand, by hand we should do the palpation, we should move our hand to over the breast, and if there is suspicious swelling, suspicious tumor, suspicious so suspicious lesion, some cracks in nipple, so we should consult our doctor. Okay. The one member has asked, does homeopathic help for the cancer? Yeah, that there is supportive evidence, that is supplementary evidence, and homeopathic, as I belong to modern medicine, as per my knowledge, homeopathic support the medicine, which homeopathic supplement the cancer, but homeopathic doesn't cure the cancer. Let me tell you, ma'am, homeopathic doesn't cure the cancer. There are certain good drugs for the in homeopathic. These are usually in low potency, high potency, but homeopathic will not cure the cancer. There is still great confusion in researchers, but a lot of patients used to take treatment at our hospital and go to the homeopathy doctor by some reference or something, and they used to take treatment there. But later on, after some days, with uh, widespread cancer, or we take it as a higher grade cancers we found in those patients. So frankly taking, homeopathic doesn't cure the cancer. Only the modern medicine will cure the cancer. The no all The next question from your member is, the only one cancer in the woman, or only one cancer in the world is vaccine preventable, that is cervical cancer. So just I already spoken out this, 9 to 26 years, 9 to 26-year woman and 9 to 26-year boys should have this vaccine, that is cervarix vaccine. The only one vaccine, the best vaccine. There are two vaccines are available for the cervical cancer, Gardasil and Cervarix. So Cervarix is the best vaccine for this cancer. Tomorrow only, each and every daughter, each and every wife should go to the doctor and take this Cervarix vaccine in 3 doses, 0, 2, and 6 months. Okay, fine. Yeah, some cancer, there are more than 100 types of cancer. Among that, 3 to 4 cancers are hereditary. Among that, in woman ovarian cancer and breast cancer, these are hereditary. If mother is having cancer, if grandma is having cancer, so daughter should be vigilant. She should be examined frequently. She should go to the doctor frequently. 3 monthly, she should have a checkup by the doctor, by gynecologist, by cancer surgeon for this cancer. So we should be the 10 times alert if your family running the cancer. So we should have 10 times alert for the cancer, and you should go to the frequent doctor and read about the cancer, woman's cancer. Yeah, ma'am. Yeah, Vaishali, ma'am. Please tell me. Yeah. So just I will tell you the proportion of women's cancer in India. Near about 75,000 women died yearly due to the breast cancer, and 1,25,000 women die due to cervical cancer. So very a great proportion in India due to lack of education, lack of education, lack of awareness about the cancer, and in rural area, in rural area, so the financial issues, poor background. These are the main factors we find out in cancer. This one of member has asked, how authentic are the vaccinations? There is a lot of confusion with different types of information. There is no confusion, ma'am. No any confusion, nothing. Only one cancer is prevented by vaccine. that is cervical cancer, and only one vaccine is the best in the world, that is Cervarix vaccine. Cervarix vaccine, Cervarix. Cervarix vaccine is the best vaccine. And one another member have asked, can eating anything specific cause cancer? Any veggies or anything? Every veggies is perfect for the healthy lifestyle, uh, healthy diet. Any veggies are comfortable. So green vegetables, fruits, these are having, they are rich in antioxidant, these are rich in multivitamins, these are rich in anti-cancer factors. So any vegetable, any fruits, all are beneficial for the cancer. This will keep away from the cancer. And among non-veg diet, I said fish is the best, though, and chicken and mutton and those non-vegetarian diet are prone for cancer. So we should avoid this cancer because this contain animal fat. Animal fat will deposit in your body, and it will cause obesity, and obesity ultimately attract all types of cancer. Yeah. So this is the uh, preventable approach. So then another factor, healthy dietary habits, as I told. Then 45 minutes exercise or daily walk. This is the best for the cancer. And positive helps lifestyle, the enthusiasm. This will keep away from the cancer. One of the member have asked, if my brother and mother have cancer, how much I am at risk? What should I do, ma'am? What cancer he is having? But my basic question is, your brother and mother having which cancer? The first, mother if having some gynecological cancer, woman's cancer, mainly the breast, cervical, and whether if mother is having breast and ovarian cancer, ovary cancer, so then you should be the 10 times high risk as compared to general population. You should have checkup for 3 monthly to the cancer surgeon or gynecologist. The first thing. And your brother is having the cancer, then there is very low risk for yourself from brother side. So mother is a mainly high risk factor if mother is having cancer. Yeah. Um, yeah. Ankita ma'am have asked, before periods I am having heavy white discharge. Is it normal? It is normal. 90% cases, the white discharge, heavy white discharge before menses, normal. If there is itching, if there is the your cloth has been wet, so we should consult a doctor. If there is uneasiness, excessive white discharge, कपड़े गीले हो रहे हैं या समथिंग येस, तो एक बार डॉक्टर को दिखाना अच्छा रहेगा. 90% cases there is no problem. There is white discharge is the due to hormonal peak before the menses. Yeah, this is natural and normal phenomenon. Yeah. Yeah, one member has asked, which is that one test for me to do generally to check what types of cancer I may have. Yeah, the first, there are three cancers. As I said, it's common in females. So the one test is pap smear test, is for most common cancer, that is cervical cancer. For breast cancer, simple physical examination by ourselves will do the suffice. And for other cancer, the ultrasound of pelvis, ultrasound of lower abdomen, sonography of lower abdomen will be suffice to keep away from them. But one test, if you ask me, then the pap test is a must. But pap test only for one cancer basically. Yeah. Is it okay? My voice is audible, ma'am? Yeah. The yeah. The second thing, women should not forget, the after marriage, the oral contraceptive pills should be used for limited periods. Should be used for limited periods. Means at least the safety level is 2 to 3 years. The woman should use oral contraceptive pills, whatever the modern pills, low dose pills used, because the excessive and inherent use of these OC pills will make your body prone towards breast cancer, cervical cancer. So we should be very cautious for the these OC pills, oral contraceptive pills. Best method of contraception is barrier contraceptive. So the woman should have safer sexual practices. Safer sexual practices means during sexual intercourses, during yeah. So they should have barrier contraceptive like condom and other substances can be used. That is the best non-hormonal contraceptive. No drugs, no hormones are used. In oral contraceptive pills, the most commonly used contraceptive method, but the condom and those are the very best. We think the is must for the safer sexual practices. Yeah. One member has asked, how do we take care of awareness of cancer for small girls? Yeah, by the help of small PowerPoint presentation, by making them aware about the when they have PWASH, we call PWASH, the first menses. Then when they go to the 8th standard, 9th standard, we should show them the pictures about all the basic pathophysiology of cancer. What is this cancer? How it is developed? What precautions she has to take? If you aware, if you keep updated these small girls, then throughout the life, she will communicate with the other people, educate the population. Also for ourselves and her family, it will be best. And we should warn that these symptoms are for cancer. So anything suspicious or anything you may feel, to then she should consult doctor. That can be also told. Yeah, yeah, yeah. The second thing, yeah, for the cancer treatment, the diagnosis of cancer is only based on biopsy. If a patient can come to us with white discharge, we used to do the pap smear test, simple test. Yeah, if pap smear test is positive, then we should go for the cervical biopsy. Biopsy means the removing a small piece of that cervix by instrument, and we send it for the histopathological examination. Means by expert doctor, pathology doctors. They used to examine that tissue under microscope, and they used to see, is there any uh, evidence of cancer cell in that specimen. If there is some cancer looking like abnormal growth, abnormal cells looking like cancer, they should report as a cervical biopsy is positive for the cancer. The next treatment depends upon doctor. Doctor plans treatment according to the age, according to the children she is having, according to the stage of the cancer by physical examination. And after that, the cancer is staged. Stage number one, there are four stages of cancer: one, two, three, four. The stage one and two are considered early stages. Stage one and two are considered early stages. The surgeries most of the times is effective for this cancer, and these are 90 to 95% curable by this surgery or removal of that organ. If women come with breast cancer, we used to examine stage that disease. First, our policy is to put a biopsy. First, the part of that tumor, we send it for biopsy. If biopsy is positive, then we plan operation. If it is in early stages, first and second stage. Same for cervical cancer. The biopsy we used to send. The same for vaginal cancer. These are we used to send it for biopsy. And after staging, if I found it stage 1 and 2 are early stages, then surgery is planned for all these cancer: breast cancer, cervical cancer, vaginal cancer. And it is found in 3 or 4 stages, means the cells has been spread to the other parts of body, other organ of body. From just like say example of cervical cancer, if cells are spread from cervix to uterus, cervix to ovary, or cervix to intestine, then it is considered as a stage 3. If it is spread to distant organ like lungs, brain, it is considered as a stage 4. Stage 3 and 4, all should remember, stage 3 and 4, these are only the stages for extending the life of the patient, temporary relief to the patient for some days. And at this stage, the chemotherapy and radiation are given. Chemotherapy means there is higher, these are high intensity drugs used to kill the cancer cell, but these have a lot of side effects. We used to prefer the chemotherapy before 45 age group, and we will also explain and take a concern of patient for various side effects like the loss of hairs, vomiting, metallic taste, loose motions, pain in abdomen, burning mutation, burning in the body. A lot of side effects. So if there is if patient is young and good health, good weight, then he is to tolerate this high intensity medicine, high concentration medicine. So we used to explain those, and if chemotherapy is suitable, then every 21 days there is one chemotherapy is given for 3 to 4 cycle, 5 cycles, 6 cycles. So one cycle constitute up 21 days. We used to repeat the cycle, repeat the drugs after 21 days. So there are 4, 5, 6 cycle as per the treatment of disease. And in some cases, like breast cancer, chemotherapy and radiotherapy are given. Both treatment are planned, radiotherapy and chemotherapy. Radiation means there is a rays from protons, rays from yeah. These are the rays are bombarded towards the cancer cell, towards the breast, and these cancer cells are killed or made static. So this there is a temporary relief for the patient and not the permanent cure. 3 and 4 doesn't have a permanent cure. Chemotherapy and radiation doesn't cure the disease. Well, there is only the lifestyle improvement, lifestyle changes, good lifestyle for the patient, but with certain side effect. So the first phase, early stage cancer, the key for the cancer treatment is key for the cancer early detection. Early detection is the key. Prevention is the key. That is the best policy for the, as you generally the medical professionals used to say, prevention is better than cure. So that is the best policy for cancer. We should be little cautious for these early symptoms. Just I have told all symptoms. So should be there is, if there is a bloating of abdomen, then I would like to discuss some ovarian cancer. That is hidden organ. Ovary is a hidden organ. Ovary is the gland in women's behind the uterus. So it is hidden organ basically, and though it cannot be seen, so very difficult to diagnose that cancer. If patient getting bloating abdomen, if patient getting anorexia, means loss of appetite, no food, no water for many days, don't want to person is person becomes moody, don't want to eat water, don't want to take a food, and his appetite is being suppressed. So that may be the sign and symptom for ovarian cancer. We should do the ultrasound, sonography of the lower abdomen in women for that cancer. So very dangerous cancer. And one blood test is there, CA125 can be done. CA125. This test can be done for the cancer. Yeah. Another question from your member. It is true that cancer cells are always present in our body. No, no. Every organ is made up of tissue. Every tissue is made up of cells. Cells are the building blocks of the body, building stone of the body. When there is this whatever the causation, whatever the etiology I have said, this uh, will affect that cells, and that the causation, that factor will make that normal cell to the cancerous cells, and after making the cancerous cells, that cells expands, that cells multiply very rapidly, uncontrolled multiplication of cells, and that will automatically, there should be a one cell, it becomes 100 cells, and automatically that cells becomes a tumor, cells becomes a gut, cells becomes a swelling. So it is called a cancer. And there are two types of tumor. One is a benign tumor, normal tumor, a simple tumor, and one is a cancer tumor. Cancer tumor, the specificity of cancer tumor is it spread rapidly from one place to another place. That is why it is dangerous. And simple tumor, if you excise that tumor, it is 100% curable. It will not spread from one place to other place. But cancer spread, that is the drawback of cancer, is placed one place to another cell. When it goes to the other places, then it is very difficult to cure. If anything, if enemy is hidden at one place in one house, that can be captured. If enemy is hidden throughout the city in 10 to 12 houses, then how it is possible to search enemy? And the cells are microscopic. Nothing, no cells are seen by the eyes. So we can't go throughout the. It's a difficult task for us. So this is basic difference between cancer and normal tumors. There are thousands of normal tumors, and there are more than 100 types of cancer. Yeah, which related to different organ. One of the member has asked, it is said that cancer is deficiency of B12 to no, certainly not. There are the different elements I have treated, but it is also true that in 20% cases cause is not found in might be due to the indiscriminate use of chemicals, indiscriminate use of pesticide, insecticides in field farms. Okay, that can be the another factor for this unknown etiology for the cancer. Okay. Another factor is uh, good health, the meditation. Uh, After we should have the right time for the dinner and lunch. We should have the right time for the exercise, and everything should be. The mental peace is important before anything. The mental peace is important for good health, for the moral health, for the proper health. We could say. Uh, this one member has asked the deficiency of vitamin B12 will lead to the aphthous, will lead to the ulcers, but very rare situation that it will lead to the cancer situation. Yeah. There are myths and there are certain facts about cancer. The cancer in early stages curable, but in late stages, very difficult to cure or uncurable in late stages, like 3 and 4, as I said. And certain immunoboosters, certain health tonic medications are available in Ayurveda, Ayurveda for the cancer cause. But uh, very rare chances that Ayurvedic drug will cure the cancer. Only the early stages, as I said, the surgery, the removal of that organ, removal of the tumor will cure that cancer. Yeah. Then research is being made for the cancer. So among this research, as I said, the cervical cancer is only one cancer in the world is preventable, only one cancer. That is a clear cut. And there are lots of propaganda has been made for different treatments, different we should different post always on WhatsApp which related to cancer. So medicine is found for the blood cancer, medicine is found for this cancer. One person that is not a doctor but he is giving medicine for, there is not a single medicine is for any blood available. No one can say surely. Researchers also, doctor also, the modern doctor also, the cancer surgeon also, specifically one drug is available for all types of cancer. So one thing is available. So these are the, we should test the authenticity of that post before forwarding that post, before forwarding it to other patients. So most of times what happens, due to that post, patient goes to that quacks, goes to that certain drugs, go to that person, and go to that spiritual leader, and ultimately treatment is delayed and stage is increased, and it will be the very hazardous for the patient. And whenever patient come to us with they tried homeopathy treatment, they tried some other treatment, they tried something other, that some relative has said go to that place, go to this temple, which was quacks, spiritual leader, guru, and all this, ultimately treatment is delayed. And at that type of point of time in stage 3 and 4 we couldn't do a lot for the patient. Only the counseling and only the relief, temporary relief for the patient, and we extend by the drugs. We could extend patient's life for certain days, some period. Yeah. So we should consult, there are doctors available in the yeah, every Indian city. So immediately we should consult doctor. There is treatment for each and every disease in early stages before it expands. So at the end, I should summarize the physical health. Physical health is important. Avoid obesity. There should be a healthy diet. Read about the occupational and environmental hazards, and restrict the alcohol use. Basically, as I said, the limitation to alcohol is the best. Only 20 to 30 ml per day is the best for the body. Then immunization against cervical vaccine, hepatitis B vaccine, these are the best for the cancer. Then safer sexual practices. These factors will keep away yourself from the cancer. And whatever you may have doubt, or you may need help from our foundation, or yeah, you may contact me anytime. Please have my phone number or email ID and my yeah, from Riddhi ma'am, and we are always there to serve you. And thank you so much the LAJA pledge, ma'am, Riddhi ma'am, and the LAJA group, all members of LAJA group are giving me opportunity to speak few words about the women's cancer. Thank you so much. Good night.